Welcome to Data Driven Health Radio.
Hi, everyone, and welcome back to Data Driven Health Radio, where we are looking at the science, the stories, and the technology that is enabling people to take a much more data-driven approach to managing their health. And with me today, I'm very honored to have Mr. Philip Blair. And Philip, I'll start by just a brief bio, and then maybe we can hear an intro in your own words, if that works for you. Dr. Philip Blair, MD, provides innovation, design, development, and implementation of cutting-edge medical knowledge to clinical management for wellness, disease, and cost control. In addition to his broad medical knowledge, Dr. Blair has an expert understanding of the self-insurance industry, medical claims, and database innovation and management. He is a rare professional who speaks the language of business, insurance, information, technology, law, patient care, and medicine. His special topics of expertise and interest are in statin drug injuries, cannabidiol, whole body vibration, and low carbohydrate ketogenic lifestyle for health. So really, really excited to have you on, Philip. All of your areas of expertise are very relevant for users of Heads Up Health and for listeners on the show. I'm especially interested in your background because you have this wonderful blend of the conventional medicine world around things like insurance and claims, but also these very holistic approaches to health as well, and an engineering background. So really looking forward to our discussion. Welcome. And maybe you can just give us a quick intro in your own words as well.
Well, David, thank you very much for having me. Love to talk to you about these subjects. They're so important in my life, and I really want to make a difference in everybody else's life using these particular techniques and methods and changing the course of the medical trajectory that we have. Now, I have a very traditional background. I went to West Point. I was an Army officer, an artillery officer. I went into medical school at the University of Miami. I went on to become a family physician, and I practiced in family practice within the military until I retired in 1996. From there, I went into occupational medicine, looking at workers' injuries, and then I evolved into disease management, specifically looking at kidney disease and trying to figure out exactly what the barriers were. And when I was in that area, I was looking at medical claims, and I discovered the massive amounts of information that were available looking at a patient claim and understanding what was going on with a patient just by looking at the claims over a time period.
Yep. And one thing I know about the claims industry is that you can look at the information there, but you don't necessarily have access to the data from the laboratory reports or the lab test results themselves. So you're basically trying to piece together a history just from the claims data. But I imagine that if you had access to other data, like lab test results, like blood sugar readings, and then you could mash that up with the claims data, it could be an even more interesting picture. But it sounds like you were able to start deducing a lot just from what you were seeing in the claims information.
Right. You can see a lot with the claims information. So you get a general gestalt about what's going on with the patient, but you can't see the details.
Yes.
Now, when you identify the patient who has a significant problem, then you can start digging in the details. In the first place, you got to go is the medical records and for the laboratory that's missing and the parameters that you need to really assess how serious that problem is.
Yep. And that's actually initially how you and I got connected. We were introduced through a mutual friend, and you and I spent about an hour last week just going over how Heads Up Health works. And we're coming at it from a different angle. We're looking at aggregating all of the laboratory tests, all of the patient-generated data. We don't have access to the claims information. So I imagine if you were able to put all of that information together, that could be an extremely powerful combination.
Well, the first thing that I always do when I identify a suspect patient or a candidate is I've got to go in and find out if those laboratories or that essential data, those parameters, really indicate that it is a disease. Just because it's on a claim doesn't mean the person has it. It just means that they have been marked or tagged and somebody's been labeling them with some illness. And so, for example, kidney disease, they may label it as kidney disease, but how severe is it? What's the degree? And the only way you can look at that is by looking at the laboratory and the notes. And that's the heavy lifting, David.
Yep.
If we don't have that information, it's really hard to get. Sometimes you need a crowbar in order to get that information out of providers.
Yes.
And yet it's supposed to be easily available. And I think that's one of the things that cripples current medical practices, because that information is not immediately available to get a true assessment of the patient.
Yes. Well, this is a bit of a divergence from where I thought we'd start, but I do want to clarify one point here for those listening, especially for our listeners in the United States, where and perhaps you can educate us, where an insurance company will have access to claims data. They may see a code, like you mentioned, for a specific condition. They may not know the severity because it's just a claim and a diagnostic code. Now, in the United States, the insurance company does not necessarily have access to your actual data from the provider. Those two are completely separate silos. And is that a regulatory thing that separates it, or are there instances where insurance providers can also get access to the data that's stored in your provider's EHR, for example?
Generally, the policy is for the insurers, they get a release of information from the patient when they initially sign on so that they can get that information. Also, providers who are part of the system realize that in order to get their claims paid, they have to provide documentation. And that means that they're going to provide those medical records of the patients.
And now there's a trend where I think providers are actually becoming their own payers. And there are certain systems where that's all coming under one roof, Stanford being a great example of that. I think it's less common, but those models are also starting to emerge. And then in that situation, they would have the end-to-end visibility on the patients.
Well, that's an exciting new area where practitioners are developing their own programs, and they are using a monthly system. And you can eliminate more than 50% of the costs involved in medical care by eliminating the insurance angle. You have a whole staff of people that's required to get medical records, to get insurance claims paid, and all of that processing. Eliminate that, and I know providers in this area of Washington State that have cut their rates by half, but they require a ongoing payment and not allowing insurance to come through their system.
Okay. Yes, that makes sense. Okay. Well, it's great that you have this incredible depth of understanding in that world, the insurance and the claims world, because we're talking about completely different.
There's more.
Yes,
there's more.
Please.
So that was the disease management area and the claims management area. Now, I left that company after a while. I didn't feel like they were doing all the things ethically that they should, even though we made huge strides in the area of kidney disease in terms of backing people up from their severe kidney failure into a more reasonable area and a life life fulfillment where they're not impaired. And just by using a lot of therapies that have been described in the literature, but the practitioners and the doctors were not really following those criteria. We also had a number of innovations, and I found the most effective area was actually dietitians. Dietitians are the most effective care provider when it comes to kidney disease and other diseases as well. And that's why I've expanded to a program of disease management, broad spectrum disease management, using dietary and a lifestyle approach. And the most effective diet for so many of these problems is a ketogenic diet. A low carbohydrate ketogenic diet corrects for so many of these difficulties. Excellent.
Well, that will be a topic that will resonate with a lot of our listeners here. So on your profile, there's 4 areas of expertise that are identified that we talked about before. Statin drug injuries is one. Cannabidiols, which we'll spend the bulk of the show on. Whole body vibration, which I think is incredibly fascinating. I'd love to learn more. And then low-carb keto. So what I was hoping we could do, Dr. Blair, is maybe just spend, say, 5 minutes on statin drug injuries, whole body vibration, low-carb keto, and learn a little bit about your areas of expertise, what listeners can do. We have a lot of listeners in Heads Up Health who are taking control of their health for the first time. in many cases, they're starting to piece together their history and starting to see signs of disease as they go further back in their data that they couldn't get before. And so there's a lot of individuals who, particularly statins being a great example, I've spoken to a number of users who are dealing with side effects from those drugs. So maybe we can spend a few minutes on each of those topics. And then the bulk of the time, I'd love to talk about the cannabidiols and the work you're doing at Elixium. Is that right?
Elixinol.
Elixinol, yes. It's fascinating.
Elixinol.
Absolutely. So I'd like to spend 3/4 of our time there, but maybe you can just start with the topic of statin drug injuries. We have thousands of users who are working on issues related to cholesterol, many of them being prescribed statins and very skeptical about taking them, many who have reversed those cholesterol issues through dietary interventions, many who have some permanent side effects. So, I mean, that's a whole show on its own, but maybe you could just share a little bit about your expertise in that area.
I'll try to abbreviate it as much as I can. I moved to Florida for 3 years, and when I was in Florida, in Melbourne, Florida, I met a former astronaut, Dr. Dwayne Gravelin.
Mm-hmm.
And working with him closely, I discovered, of course, he was the premier in terms of the anti-statin movement because of his research and development and his own personal injury, and talking about creating a website for 10,000 people to participate in identifying these terrible risks. He had the traumatic event of having a global amnesia on 2 occasions directly as a result of statin use. And he was probably the bellwether event. And he started producing a lot of information and organized quite a bit of the anti-statin approach. He was also looking into great detail about the science. So I was working with him closely, and we co-authored a paper on the adverse effects of statin. That was a published article in Physicians and Surgeons in the United States.
Yep.
We're very pleased with that particular article, but it was a sort of a manifestation of a lot of the work that we had been doing and looking at statins. And so I was really educated with regard to statins. I certainly matched up with him, and I was actually stepping in and speaking for him as he was fairly elderly and had some impairments at that time.
Yep, understood. So this is an astronaut who had a personal event related to
That's right.
these prescriptions, and like many people, myself included, that sets us down a path. In my case, it was to create Heads Up Health based on my personal experience. In his personal experience, it was to start to put education and information out there to potentially help and inform, maybe even protect to a certain degree other people who may be going down this path. So am I understanding the scenario? And then you came in to help him evangelize and communicate and post and share. Okay, that's fantastic.
Well, part of that was the exploration of the damage that statins are doing and their involvement in medical care, conventional medical care, without any of the awareness of the complications and the problems that are associated with statins. You know, things like a 14 or 15% incidence of diabetes being induced by statins. Things like permanent neuropathy being occurring. As many as 24 or 25% of people will develop a neuropathy. It's not all permanent. About half of them are permanent. It's not a matter of just taking it one time and, stop the medications and your muscle aches go away. This is a permanent change that will occur.
And what other kinds of side effects and related injuries can result? I spoke to one of our users who had some permanent joint damage. You've mentioned a couple others in terms of neuropathy and diabetes. Some people, I think, who are listening may not even have made the association. They may already be experiencing some of these things and not be aware of the correlation, for example. So what might be some of the other things that an individual should look for if they're currently on these medications or being prescribed these medications?
Well, number one is your general feeling of well-being. You lose energy. It depletes your energy ability, so you feel fatigued all the time. Not only that, you'll have muscle pains and cramps. And that's not just a disconcerting symptom. That really amounts to some malformations of and some destruction of muscle cells, to the point where if enough of those go out, they actually damage the kidney. So you can develop kidney failure and then permanent damage to the kidney area.
Yep.
So there are cognitive issues that occur using the statins, and a number of medical problems that could be generated. We're just beginning to see what those are. And it's all misguided in the idea of lowering cholesterol, that somehow that's going to be protective. Cholesterol is a healing molecule.
Yes, it is. Repair substance.
With as a disease source.
Yes.
It's just a molecule that you can identify. And in the brain, we make most of our cholesterol, 80% of our cholesterol. And to stop that particular process, particularly in elderly, makes them more prone to dementia and neurodestructive and neurodegenerative type of conditions.
Yes, and I can start to see how that's now starting to feed into some of the work you're currently doing with some of the alternative remedies that we're going to speak about. So the paper you published and the resources that were published as part of your work with I'm Dwayne, what was his last name?
Gravelin.
Gravelin. Where would people find that information if they wanted to look at it? We'll post it.
It was done in 2014, so it was released at that time.
Yep. And are there other resources online, Dr. Blair, that you would direct people to if they wanted to start some of their own exploration into this topic?
Space Doc is still an active website. It has a huge amount of information, and it's quite active in providing a resource of information about the derogatory effects related to statins.
Okay, that's wonderful. Thank you. Okay, well, the next question I had was around whole body vibration, and I am incredibly intrigued about the notion of sound healing, frequency healing, light-based healing. I think as we learn more about how our bodies are engineered, about how entanglement and physics and everything works in terms of our human experience, these are topics that are incredibly interesting to me. So can you share a little bit about your work in that area?
Yes. So I was working in disease management. We found that a very low carbohydrate diet was effective for all kinds of things, including depression, anxiety, and arthritis.
Yep.
Well, not that you would normally expect that to happen, but these were very, very effective areas.
Yep.
One of the problems that we had with, and we continue to have, is people who are severely obese, is that they don't exercise. They can't exercise.
Yes.
And how do you get somebody who is not exercising to an exercise point? Is there a passive exercise ability? And whole body vibration may offer a solution in that. In fact, whole body vibration is now being used in intensive care units for people who are bedridden and disabled in that intensive care setting to exercise them. It's an interesting engineering and physics type of problem. And the physiology is fascinating. When you are on a platform that is moving like this, it's oscillating, then as one foot goes up, then the other one goes down, and vice versa. When the muscle goes into relaxation phase, as it goes down, it actually contracts. We have a reflex contraction that occurs. And capitalizing on that particular effect, you can exercise your muscles, individual muscles, at the rate of 40 times a second. So in essence, you can get mirror walking and doing a mile in less than a minute using a whole body vibration at 40 oscillations per second.
Yeah, the first time I came across that was when I went to one of Dave Asprey's first conferences back in 2012. This was still when he was still underground and small, and he's obviously exploded since then, but he had the Bulletproof Vibe there, and I had a chance to step on it and try it. And so that's a platform like you described that oscillates at a defined frequency that's been engineered for optimal health. So it sounds like that's also come up in your line of work, which can be extremely helpful. I'm particularly interested in the people who are bedridden, because as you mentioned, it's extremely difficult to even move in some cases. So what kinds of changes would you see, for example, for someone who's dealing with a chronic condition, maybe it's obesity related or something like that, where you introduce vibration into a hospital bed, for example?
Well, there's a lot of talk about vibration. And when you're talking about whole body vibration, that's a misnomer. You're talking about sound vibration. You're talking about other types of vibration that may have particular value, but this is really a mechanical oscillation.
That's what I was referring to. So can you put that into a clinical setting, into a hospital bed?
There's ways to do that. You tilt the patient up at about 45 or 30 degrees,
Yep.
and you strap them to the base unit, and
Yes.
you allow it to oscillate. You're not going to necessarily do it 30 hertz or 40 hertz. You're
Yep.
going to adjust it to meet their particular needs.
Understood.
In terms of the rate that it would be needed for restoring some degree of muscle function and flexibility is around 10 to 15 cycles per second. You get up into the area of about 16 or 18, then you're talking about muscle building. You're actually building muscle in that way. Now, is it going to make you lose weight? No, it's not in particular going to make you lose weight. It's not like those fanny belts from the 1950s.
Yes.
It doesn't make you lose weight, but there's a lot of signaling that goes on with the body with exercise, just healthy signaling that indicates to the body to balance its hormones, help it with some of the epinephrine and the adrenaline and the cortisol that are circulating.
Yep, that makes perfect sense. And I've seen in other instances, we have a lot of people who are measuring things like steps per day using Fitbit. And I've seen negative press saying we did controlled studies and the Fitbit group didn't actually lose weight, the people who were tracking. But it's not about losing weight, it's about movement. And movement at any level has cellular benefits, muscular benefits. So like you said, even though you're not losing weight, just the actual movement in general is where a lot of the health benefits come, even if it's not showing up on the scale per se. So
well, that's right. And people don't lose weight by exercise. That's a total misconception.
Yep.
And yet it's been promoted by that particular industry, the health fitness industry, in terms of doing exercise. It's helpful because it signals the body. It gives the balance of the hormones that we talked about. But it doesn't make you lose weight. You cannot do enough exercise to burn off all the fat that you accumulate. You've got to do that with dietary measures, and that's where the low carbohydrate and ketogenics come in.
And what about for someone who is healthy and just wants to perform at a higher level, or wants to use whole body vibration as a biohack, for example? The Bulletproof Vibe, last time I looked, this was years ago, was somewhere between $1,000 and $1,500 to have a unit at home that you could actually use on a regular basis, which obviously puts it out of reach for most people. So are there other more affordable ways to get access to this modality for people who are healthy but just want to use it?
There's all ranges of prices that are out there. Some of them are not as good, but anytime you can use a whole body vibration. I particularly like the oscillation one that goes like the teeter-totter up and down versus the linear going up and down. There is a very nice effect. You don't necessarily have to get the top of the line. If you can, certainly that's beneficial. But there's a lot of variations. In a few blocks from where I live here in Vancouver, Washington, there's actually a vibration studio. And they have a dozen machines or a half dozen machines there, and they bring people in for a program therapy session. And they do it 3 times a week. In fact, we're developing with the proprietor there, Misty, I'm developing a program to look at and to treat PTSD using this vibration, whole body vibration, along with cannabidiol. Combining those 2 measures may give the magnificent benefit for people with PTSD.
That's cool. And perhaps we'll include some of your recommendations on some makes and models out there for people who are at home and might like to try this type of therapy. So if you have a couple products you might recommend, we'd love to include those so that people don't have to go out there and use a trial and error process. Are there specific models or products or price ranges that you could that we could include in the show notes?
Well, unfortunately, the price range does get up into over $1,000. I mean, I worked with, and I have a whole body vibration unit from Hypervibe. And Hypervibe has been really good with a very effective machine that gets into the range and the gravity formation that needs to be there. What you're doing with this pushing you up and dropping you down is sometimes considered hypergravity
Yep.
by forcing up, and that extra gravity actually, it makes you work harder, and it
Yep.
also has that reflex contraction.
Yep.
So Hypervibe was one company that I had worked with, and I had several of their units. I was very pleased with
Yep.
the results from that area.
Yep.
The other units I don't have a lot of experience with. I can't
Fair enough.
do much in the way of confidence. But you could spend $15,000 on one of these units. On the other hand, an Amazon unit for $300, I'm not enthusiastic about that.
Understood. Okay, thank you. So moving right along, low-carb keto. This is a subject near and dear to my own heart. I've had wonderful results using low-carb ketogenic approaches, as have most of the users within Heads Up Health. That's a lot of the current engineering focus within our product is building features specifically to help people on this journey. And where the data comes in is to help people personalize these approaches for their own body, because someone who has no metabolic dysfunction whatsoever may have a much different experience with keto than someone who does have significant dysfunction. And being able to fine tune and tailor things like the carbohydrate level to enter into ketosis for two people could be completely different. Being able to monitor your blood sugar and be able to start to see that come down can start to help you, give you clues that you're doing things right. Being able to track things like blood, breath, and urine-based ketones, for example, and then being able to see your blood work right next to it. So we're doing a ton of work in that space. We're integrating all of the devices and apps and other products that can help people figure this out, because it's not like you go to the doctor and get the keto instruction manual. It's something that you decide to take on yourself. You start this educational process, as you know. If you're fortunate enough to work with an expert, you can probably short circuit a lot of the learning curve and a lot of the trial and error. But most people out there are just hearing about it anecdotally, starting to do a lot of their own research. It's a trial and error process that can be overwhelming for some people. So there's definitely areas where I think data can help, but I'd love to hear how you're using these approaches. I know that your experience in chronic disease management and the chronic diseases you're working with are all very closely correlated to the benefits of keto. So how did you stumble into this world, and how are you applying these principles in your work?
Remember back in 2000, I was part of this disease management program. I aligned myself with a very effective dietitian, and we worked and performed miracles with kidney failure patients.
Yep.
After we got out, we started our disease management program. At that point, I discovered that she was using a form of a low carbohydrate approach, and that's where she was getting her results from. Well,
with kidney disease specifically?
Yes.
Okay. Great.
And we capitalize it. Well, most of the kidney disease and the ones who are in failure, there's a lot of metabolic syndrome and diabetes.
Yep.
And that leads to the inflammation of the kidney and leads
Yep.
to kidney disease that goes
Yep.
on. If you can address that, and naturally you've got a low carbohydrate approach is the ideal therapy for any type of diabetes or metabolic syndrome. So you start somebody on that, you're going to stop the inflammation and you're going to stop the progression of kidney disease with that. So in discovering that, reading Gary Taubes and
Yep.
finding out about good calories and bad calories,
Yes.
and understanding the core metabolics and physiology that was going on, as well as the erroneous and false literature that was out there, and applying this, I was just seeing such dramatic improvement in patients' lives and their conditions using this approach. And the farther we got towards ketogenesis or ketogenic diet, we did better and better in using that. But not everybody's ready to go there. So it takes an enormous amount of hand-holding for most people. So with what you're doing, that's great. People are on board, they are diving in, and they're using all of the tools at their disposal to guide them through this course. And you're exactly right. It is customized to the individual. 30% of the population has no problems with carbohydrates. They can eat whatever they want.
Sure.
And they don't have any difficulty. But the rest of us, the 70%, have a great deal of difficulty. And carbohydrates in large measure are poisonous. And they run into major problems with us.
Yep. Yeah, that's exactly why we started down this path. When I first built Heads Up Health, I'd never even heard of the ketogenic diet. And we put the product out there, and some of our most active users were logging in 3, 4, 5, 10 times a day. And so I was flattered, first of all, that somebody had found value in our widget, and encouraged them to keep going. And then I tried it myself, and it was fantastic. I didn't need to use it for any specific medical condition. It was mostly an N=1 experiment, just because I kept hearing about it from people. But it's been 2+ years for me since I've been on the keto diet. I've had wonderful results. Most of our users are using keto for diabetes, prediabetes, cancer as an adjunct therapy, all of the other conditions that go along with it. So it's something that is very relevant for all of our users. So just
but
great
everybody
to hear.
requires a custom approach, and
Absolutely.
your application has a terrific feature in the ability to gather that data in one place so that you can see a linear relationship and the associations that you need to see. Find out how many carbs that you can take in.
That's right. Yep.
How much food can you eat? How many calories is okay to have?
Absolutely.
What substances will throw you off track?
Yes.
And what happens if you break down and you make a mistake, or you binge at some point? How quickly do you get back in there? So, in this particular area, there's a lot of intensity about monitoring and working through those parameters to find out what is the optimum diet and methodology for you. I worked with Eric Westman for.
I know Dr. Westman. Yep.
For 3 days, I covered down on him while he was seeing his patients. I really started to understand all that he was using and the incredible results that he was getting at Duke University using this particular approach. And I was really excited to work with him and then to gain that information. And I really love his very practical approach about getting so many people on board with this program who are really ignorant of. The people that you're working with this application generally are knowledgeable on it. They have done the research. They've looked at the literature. But a lot of the people that Eric was working with had never seen anything. Sure. It was a strange sort of phenomena that he was using in the Duke University setting that was not accepting of what his program was. So exciting to see that, but it does take hand-holding for people who are not already indoctrinated or self-indoctrinated.
Yes, it's not easy, and it's intimidating, and it's overwhelming, and the amount of experts out there that can scale to help anyone who needs this is just never going to work. So
that's why we incorporated the dietitian group. So with myself at the core, a program called Pro Health Advisor. And what
I read about that on your profile. Yep.
We've engaged with a self-insured business that's providing health insurance for their employees. And then I use the data to identify individuals who have significant disease, whether it's diabetes, fatty liver, or a metabolic syndrome, or cancer, or arthritis. Target them, contact them, get them involved, and recruit them to talk with our dietitians to get started on this particular program. And then we monitor them for results. And by doing that, they actually get a savings within their insurance that they don't have to pay copays or deductibles for those medical problems that we're working with as a part of this health maintenance and wellness program. So very, very innovative. And we're saving thousands and thousands of dollars in this process.
Yeah, well, I can only hope that more insurance companies start to come on board and start to endorse and reimburse and support these types of interventions, because that's obviously not the case today. And there are different theories about why that might be. There's certainly no prescriptions involved in this procedure. And so it gets complicated, but would love to see more employers, more insurance companies coming on board to recommend these interventions.
Well, here's the problem. It's the money at risk.
Yes.
The insurers don't have any money at risk. It's the employers who have their money at risk. And then some of the large institutions who are what they call the carriers, who've got the big financing at the top. But otherwise, the insurers are just a pass-through. Whatever the current rates are, they're just passing those along. And there's not, they don't have any skin in the game. So they don't care what comes out. They're just passing along the prices.
Fair enough. Well, that's definitely an area we'll continue to invest in. We see the benefits of these approaches every day. We've invested heavily in supporting anyone who wants to come on this diet. There's absolutely an educational and knowledge barrier to entry. There's absolutely the need to personalize. So we hope our product is helping in that regard. And it's definitely an area we're going to continue to invest in. And I think all of this is leading up to the conversation I'm most interested in, which is the work around cannabidiols. I've had family members who have had incredible experiences using these products personally. One family member in particular who had kidney disease and was able to use different interventions around cannabidiol, specifically medical marijuana, which is obviously separate, but in the same thread. So I'd love to segue into that. And we have a number of our listeners who have submitted questions that I'd love to get to at the end. But first and foremost, I think let's just level set on the difference between CBD and THC, because they're very different. One is a psychoactive, and one of them, there is no psychoactive component to the CBD. So let's just dispel that first and foremost, so that people don't think that this is going to be a psychoactive experience. So just break down the difference for us first between those two, and then we'll build from there.
Yeah, let's put it into simple categories. Basically, you've got two plants.
Yes.
You've got marijuana,
Yep.
and you've got industrial hemp. They're both
Yes.
cannabis, but they're completely different characters. The
Correct.
marijuana is that short little squatty
Yep.
plant. They're going after the buds. Well, the industrial hemp is a tall, lanky that's used for fiber. It doesn't contain any significant amounts of psychoactive substance.
Yep.
Now, marijuana contains THC in significant amounts. Sometimes it's up much as 25% or even higher. But the industrial hemp has very, very low amounts. And usually those fields and those plants are tested to see what they're contained. So in among the cannabinoids, and so if you're talking about these particular molecules, which are about 22 carbons, so that, and reason I bring that up is that's very similar to omega-3 fats, is that there are 22 carbons. And I'll get to the connection with that later on. But these small molecules, and if they're in a certain structure, they represent cannabinoids. And these are signaling molecules. It's not a matter of they're being metabolized. They're signaling molecules, and they signal and they have an impact on the body in different areas. Now, you know, THC causes a high. That causes a certain amount of impairment. It does cause provide some analgesia, but it also, and it's some anti-cancer effects. But there's a lot of impairment, and there's a lot of hunger. So it's stimulating a number of different aspects, not only the neurotransmitters, and the immunologic, but it's also doing the hormones, in particular the gut. If you move away from the substances with THC, and you're looking at industrial hemp side, the industrial hemp side doesn't have any significant THC, and so you're getting mostly is going to be cannabidiol. Now, there are other cannabinoids, but for this discussion, let's just stay on the topic of THC and CBD, and I'm going to focus entirely on CBD, because what I've seen is that the medical benefits, and we talk about medical marijuana, which is really a blend of THC and CBD. I've seen almost all of the medical benefits be available in cannabidiol alone, so that THC is not required. Now, it does offer some benefits in special cases, not at high levels, but at very low levels, and that will amplify and enhance the effectiveness of the CBD, but it's not required. That's a misunderstanding that a lot of people read into it, and it's a little bit of a fiction that is promulgated by the marijuana industry.
I think that's really important to clarify just for everybody, that there are no, what we're talking about here is CBD oil. I think a lot of people may associate that with marijuana, which is not the case. We're talking about the non-psychoactive component. People may have had experiences with products that are blends, because they do sell blends in different ratios of THC to CBD. That's also not what we're talking about here. So what we're going to talk about for this discussion is exclusively the CBD-based component. I took a quote that you made on the website for your company, saying that cannabidiol is the most profound and exciting health-promoting substance I have ever witnessed or experienced, which presumably is why you've gotten involved in working with this firm out of the Denver, Colorado area that's bringing this product to market. And because it's 100% CBD based, you can ship it anywhere in the world. This is not a regulated product at all. So we'll be specifically speaking in those terms. And I just want to clarify for everyone that that's the product we're talking about. None of the blends, just specifically the CBD oils. So for those who have tried it, had a product that gave them a psychoactive experience, we're not talking about that. This is a very specific discussion.
Let me just say that about the jurisdiction and the legal aspects of it, there's a lot of debate about it.
Sure.
A lot of concern. If you really want to read about some more detail and have an understanding of going back and forth, then you might look at Wikipedia. They've done a pretty good discussion about cannabidiol. The federal government, what they say and what the states are saying and what the science says, putting those all together is a bit of confusing, and you'll get different opinions from different people. Fact is that Elixinol is a global company, and it's providing cannabidiol in 23 different countries and every state in the union, and it's available by internet ordering anywhere.
Yes.
And personally, I talk to people in Japan, in Slovenia, in the UK, South Africa, Australia, New Zealand, Korea.
Yep.
You know, I've got a dialogue with thousands of people in all different areas, and they're all using cannabidiol, and just a wonderful effectiveness for many of the different things. But the legal aspect is really a touchy area. I've never seen anybody incarcerated or any legal problems because of it specifically, but there is that risk and concern.
Yep. But on your company's website, the product can be ordered by anyone within the United States, and in addition to 23 other countries.
Exactly.
So let's set the record straight on that. Now, if you could, Dr. Blair, educate us on CBD. And some of the information I found fascinating was the phytonutrients that are involved in CBD, which can be incredibly healing, and getting it in its natural package also is the way nature intended it to be, all packaged up, versus distilling these things out. So if you could, for those who are not familiar, educate us on some of those phytonutrient and other health benefits that are part of the CBD plant. Because when I was reading it on your website, it was incredible. The antioxidant benefits, there are signaling benefits. This is an incredibly powerful compound. So could you share a little bit more on that?
Yeah, be glad to. Now, when you take the cannabis plant and you extract the juices of that, you really are looking for a product that is a full spectrum, that has a little bit of the other cannabinoids that need to be there, and some of the polyphenols and some of the other substances that are naturally occurring. They produce what is called an entourage effect. They really balance out and they round out the cannabidiol so that it is more effective, and it works within the body in a more effective way. Now you can take, and there are products that are being made with just pure isolate of cannabidiol, and it doesn't have any of the other molecules on. I haven't seen the performance of those particular pure molecules performing as well as the full spectrum products.
Yep.
I think that's why you should look at a full spectrum rather than an isolate.
Yep. And cannabinoids in general have very specific healing properties. And so perhaps you can just explain a little bit about more about what they are, and just get into some of the mechanisms around how these can be so powerful. I also found it interesting that on your website that every culture going back into human history has identified these as a plant with incredible healing properties. So just how do these compounds in there work, and share a little bit more for those of us who are new to how this stuff works.
Well, I think the most important to understand is that within our bodies, we have our own cannabinoid system.
Yes.
It's called, just like the endocrine system, meaning inside, and the crine meaning having to do with hormones. So we have our own endocrine system. We also have our own endocannabinoids.
Yes.
We make our own THC-like molecule right inside our nerve cells and right within some of the molecules and that are macrophages and immune cells. And so we've got an entire system that is sensitized for our own cannabinoids, but this plant has found a way to provide the phytocannabinoids, the one
Yes.
from the plant, to be able to deliver the body and signal to make changes. You know, what over the last 4 years, I've realized that the endocannabinoid system, our endogenous system, is a mediator. It's like a translator for what's going on outside of the world and bringing it in, as well as what's going on inside, like in behavior, psychology, experiences, emotion, and putting that out, changes on our physical body as a result
Yes.
of that. So
Yep.
it's really acting in an intermediary way. Now, the main functions that I see with the cannabinoids within the body amount to the neurotransmitter area. The synapses between the nerves are very sensitive, and the cannabinoids actually modulate in that particular gap
Yep.
between the nerve transmission. So
Yep.
neurotransmitters, key and important. Number two is immunologically.
Yep.
We've got an immunologic system, and we're constantly exposed to immunologic threats in different areas. And right now, the common disease problem that we're encountering is an overactive immune system. So there's
Yes.
development of autoimmune diseases where we start to attack our bodies
Yep.
for whatever region, and that also represents in a great deal of allergies that manifest. So how can that be controlled? And so cannabinoids might be a way to control a lot of that hyperimmune reaction that's going on.
Yep.
And then third area, and it's not the least and it's not the only, has to do with hormones.
Yep.
The modulation of the adrenal hormones, of the thyroid hormones, of the pituitary hormones, of the sex hormones.
Yep.
These are all under the modulation of the endocannabinoid system. Now,
Yep.
we didn't really know much about this, but the breast produces a magnificent cannabinoid. An anandamide is the name of the common word for the stimulating substance. And that cannabinoid is actually what stimulates the child to suckle. If you've ever watched a nursing child, you've seen them go to the nipple, and they get really excited when they get milk close to the nipple and they smell the milk. But when they latch onto the nipple, anybody watching a child will be taken by a number of gulps of that breast, and then they'll roll their eyes back and smile and go into
Yes.
a very relaxed state. That's cannabinoids.
Yes.
That's what's doing that.
Okay.
And the same thing is involved in the setting up of the uterus in preparation for the egg implantation. And the first cannabinoid receptors are actually on the morula. The early fertilized egg actually has cannabinoid receptors that are active. And it's very, very important that we have a balanced cannabinoid system in that process. Now, that leads to a problem that we're seeing more and more of, is a clinical endocannabinoid deficiency phenomenon.
Yes.
And we're seeing more and more of these diseases match up and correlate with imbalances in the endocannabinoid system. So a lot of the mystery diseases that we have there may in fact be related to dysfunctions in the endocannabinoid system. And that's where these phytocannabinoids come in. And that they can serve as signaling molecules and to return balance to the body and restore that unbalanced system.
Yes. So in many senses, it's a deficiency in the body's own levels of these compounds. And I think it's just incredible what you said there. For those, let's just repeat it here. The body has its own internal endocannabinoid system, which is in the body already. We're born with it. And it has signaling implications for everything from the neurotransmitters in our brain to the immune system to the hormonal system. Adrenal and thyroid are both epidemic conditions out there already. Hyper and hypothyroid, adrenal dysregulated issues due to stress, due to environmental toxins, due to all kinds of different things. So this endogenous system that we have has signaling implications in all of those areas. And you're seeing a deficiency in the, whatever you want to call it, the food system, the health system. We're not getting enough of those compounds naturally into our bodies. And that's the potential for a lot of the CBD-based products to come in, exogenously take them, and then start to balance out and regulate some of these internal signaling systems inside of the body. Am I feeding that back correctly?
You are, but you're putting it too narrow. You're putting it on the food, and it's much broader than food. It's experiences. For
Yes.
instance, in PTSD, childhood abuse has actually leads to the potential for PTSD. In fact, that's probably the most predisposing factor, whether it's child abuse or abuse, neglect. All of those things lead to a shifting and a dysfunction of the endocannabinoid system.
Experiences, life experiences.
Yes.
Wow.
So that's what I was talking about, this translation,
Yes.
that these events that are occurring outside are being translated into the body in terms of physical illness through the endocannabinoid system.
Fantastic.
We didn't know how it worked, but
Yep.
now we're seeing this evidence of the sensitivity that the body has to these environmental things. And that goes along with the microbiome. The microbiome is also signaling in similar way. Just as the microbiome produces some of the beta hydroxybutyrate that is stimulating and balancing and restoring for the brain, the same thing has happened with the endocannabinoid system, that there's signaling that goes on with the bacteria and it's using some of the endocannabinoid system. In fact, one of the highest populations of cannabinoids, endocannabinoids, is located in the gut.
Mm-hmm.
I didn't say that as a separate issue, but the gut has a massive amounts of neurotransmitters.
Yes.
And so therefore, it's going to be quite a bit involved with the endocannabinoid as a regulatory measure for those neurotransmitters.
So let's take this forward then to some of the applications, specific applications. Most of our users are working on one or more chronic diseases. And I'd love to just talk a little bit about how these products can be implemented. I've got a list of them here, but maybe we could start with migraines, for example, and then just run down the list. I've got migraines. We have diabetes, cancer, especially, and then just kind of go from there. But how are these making their way into the treatment of these specific conditions? And when might you want to start employing them?
It turns out that patients are finding them. They're failing at usual therapies, and they're being introduced, and they're looking for something more. Typically, I'm fairly transparent, so people are able to find me and ask me for a consultation to find out if CBD is going to be effective for their condition, especially when they haven't been successful with the standard medications. And it's essentially the frustration that patients feel that gone so far and they haven't been benefiting from conventional therapy. Then they're ready to flip over to do something alternatively and to incorporate the possibility and do some experimentation, N=1, for themselves with the cannabidiol in particular.
So let's get into a few specific examples. I know diabetes is one, which is ultimately.
Well, we're going to go back to migraine because you brought that up first.
Sure.
And migraine is particularly valuable. Now, using cannabis for migraine was actually the primary therapy in the mid-1800s, and it was in standard medical journals as well as available as a substance from the pharmacy. It was actually prepared and it was in the pharmacies the standard way. And cannabidiol is just as effective for migraine headaches. And I've been able to have people stop and prevent migraines as well as treat migraines using the cannabidiol. The dosage is, first of all, migraine, we're not sure, it's still not well defined exactly what is a migraine or what causes a migraine, where the problem is.
But a lot of people are trying to figure that out, and they're doing trial and error, and they're doing their own N=1 experiments. Is it food sensitivity? Is it something related to all kinds of external factors? So yeah, we have a lot of people trying N=1. I'm sure a lot of them would love to try this intervention as an N=1 as well.
Yeah, and I've had great results using cannabidiol in a modest dose as a maintenance, and then when the acute headaches, increasing to as much as necessary. Now, the general dosage guidelines with cannabidiol is that, number one, it doesn't have any toxicity and it doesn't have any significant adverse effects. And so the real guideline is use as much as needed in order to control your symptoms and then readjust it. It doesn't matter whether it's twice a day or 3 times a day or 4 times a day. Adjust it to your particular need. Now, you need to get a good product, though. There's so many products that are out there in the market.
Yep.
You can't be sure what's in them and how effective they are.
Yep.
That's why I've gone with Elixinol, because I know what the product is. I can see full analysis, and I know what the balance is in those molecules and the dosage range for those particular problems, whether it's migraines or diabetes or cancer. I can get people started and then help make adjustments as they go along.
So let's jump to cancer then. I have people in my own friends and family who are working with health practitioners. In these cases, they've already been diagnosed, and they're working with a integrative oncologist who is including this as part of the regimen. In other cases, I'm really curious about your thoughts on using them as a preventative mechanism for cancer. So both from a prevention and from a treatment point of view, can you share how these products are used in the realm of cancer?
Yes. So cannabidiol has actually get some extraordinary evidence in preclinical studies. We don't have any human studies. There's a lot of complications for doing human studies, and we're not right at that level yet. We don't have those, and that takes decades in order to produce that. Mm-hmm. But the preclinical evidence is really superb. Almost all cancer types respond to cannabidiol in terms of their cannabidiol having this feature that it induces cell death in cancer cells. But not only cancer cells, any abnormal cell, it will induce a death to it. It's self-death. It doesn't kill it. It signals the cell to die. And in that process, it self-destructs.
Autophagy, is it the same as autophagy, for example, when you're fasting, or is it different from that?
It's similar to that, but actually that autophagy is actually the breakdown of the materials of the cell, but what the cell death is that is slightly different in that. And the cannabidiol is inducing a cell death. Now, at the same time it's inducing cell death in the abnormal cells, it's supporting and protecting normal cells.
Yep.
So you can immediately see it in the case where you might get chemotherapy. It's going to protect the normal tissues, which is so often damaged by the chemo and radiation, while killing and facilitating and enhancing the killing effect of chemo and radiation on those cells, as well as it's having its own properties. Now, for the cancer effects, cannabidiol has been shown magnificently to have that effect of killing the cancer cells, but also preventing metastasis and preventing extension of the cells. So as they spread out, they can't spread out. It blocks that spreading. And it prevents the formation of the vasculature that will be associated with it. And it stops the inflammation that is surrounding the cells. In addition, it continues to paralyze the cancer cells at the mitochondrial level, so they cannot function properly. And that's another reason why they induce apoptosis, the killing, the self-killing that goes on with it.
So it sounds like those things are very similar to the reasons people are using ketogenic diets for cancer. The same types of reasons, starving the cell and preventing growth of the cancer cells while not inhibiting the growth of the healthy cells, using a ketogenic diet as an adjunct to chemotherapy to help lessen the toxicity. So when I was hearing you state those benefits, that's all the reasons people come to me and tell me they're using a keto diet for cancer. And it sounds like the cannabidiols are doing the same thing. So it almost seems like you could get a 1-2 punch if you combine low-carb keto with
right,
like another exponential way. And even if you are using it with a conventional chemo, it sounds like these are very complementary and perhaps far more powerful together than either one of them on their own.
Ketones specifically act at certain receptors in the nucleus. It's called the PPAR receptors. And they're signaling that receptor to produce a cascade of anti-inflammatory cytokines and reflexes and enzymes. It's also signaling the mitochondria to change their metabolic slant towards fat metabolism and away from carbohydrate metabolism. And that's the same thing. Cannabidiol does the same thing, but cannabidiol goes much further. It's just that as you mentioned, starving the cancer cell, not allowing any carbohydrates for the cancer cells to bypass and get around and defend themselves, and really with the ketogenic diet being really focused on both the nucleus and on the mitochondria, and denying substrate for them to for metabolism and growth. On the cannabidiol side, you also have that anti-metastasis feature and the anti-blood vessel feature that goes into it.
So let's shift a little bit to prevention, because we talked about treatment, and a lot of the prominent speakers in the ketogenic world.
But just before, I don't want to go too fast on the cancer.
Got it. Please, yes, close out there.
There is some specific protocols that I found very, very successful via the Elixinol product. And I can highly recommend. I've got a number of patients who've gone into remission from stage 4 disease.
Yep.
Now, this is certainly no guarantee, and I'm not going to suggest that. But using cannabidiol, you actually get a number of other benefits that come in, and I often overlook the benefits. You know, the anti-nausea effect, it comes with the cannabidiol. Improvement in mood and general well-being. The analgesic effect. They're so often patients with cancer are sick and they're in pain, and the cannabidiol will help correct that, as well as treat depression and mood disturbances, and protect their normal tissue from that chemo and radiation. So cannabidiol offers a host of other benefits and protections in the treatment of cancer, and is great in combination with a ketogenic diet. But unfortunately, so many patients are not willing to go the ketogenic approach for situations. So combining those would be an ideal situation. And I tell people about the ketogenic diet, but I have very few takers who are really willing to go there.
Understood.
In terms of dosing for cannabidiol, using a full spectrum product, I found that 90 milligrams is an effective dose.
Yep.
You don't have to do 2,000 milligrams. Not in my experience with the remissions I had. It's on the order of 90 milligrams. And there are a few other things that we need to talk about, and that is omega-3s. Cannabidiol does not work in omega-3 deficiency. And the reason why is that omega-3s are precursor molecules to the endocannabinoid system.
Okay.
And cannabidiol won't work in it. You've got to have the omega-3s because they represent a major portion of the receptors on the cells and the signaling molecules that the body uses in the endocannabinoid system for telling the body what to do, and action-oriented within the cellular systems.
Yet another reason to be making sure that you're properly getting enough omega-3, either from diet or from supplementation. So that sounds like it's an important part of the puzzle here as well. Are you seeing, Dr. Blair, any of the conventional treatment facilities starting to adopt this alongside the conventional treatments, or is this still not something that is acknowledged, recognized from traditional chemotherapy-based approaches?
I don't see anybody using this particular approach. They're very reluctant in light of some of the controversy that goes on.
Understood. Okay.
So, but in terms of prevention of cancer, I mean, this is really quite valuable. Yes, it has, because of the benefits of cannabidiol in general, low doses of cannabidiol could prevent cancer very effectively and prevent recurrence of cancer after somebody has already had it. The patients that I have in remission are perfect examples.
Well, if you listen to experts like Dr. Thomas Seyfried, Dom D'Agostino, they often will state that as a preventative technique, an extended fast done once or twice per year, where you're pushing your glucose ketone index below 2, for example, is an effective cancer prevention strategy. And just being on a low-carb diet in general can be a preventative strategy. There are cancer causes coming at us from all angles in our society: toxicity, exposure to chemicals, excessive sugar consumption. So there's all of these forces coming at us. What are our defenses? It is using a low-carb diet, potentially doing extended fasts throughout the year, perhaps twice a year, where you do a 3-day fast or longer. But I'm also very interested in this as cannabidiols as an add-on therapy, where this is just something. I mean, I've got a handful of supplements on my desk I take every day. And would this be something that could be safely added on a daily basis as part of a prevention strategy, just like you'd take an omega-3 fish oil? Is that a good way to think about it?
I think that is a very good approach. It has preventive qualities, but it also provides in performance enhancement. So what I see using cannabidiol is a number of particular benefits that are wonderful features, and it's sort of ideal for a supplement. Things like improved mental focus and clarity, clearing the fog, a relaxation and a calmness so that you're better able to deal with situations. The concept that you want to take care of stuff and get things done, a motivational and an action-oriented, so you really truly activate. There's also an improvement in your vision. So you're actually seeing better, greater distance at greater refinement. And I have to warn people that they may have to get new glasses when they use cannabidiol because their vision will improve.
And what would be a maintenance dose? You mentioned 90 milligrams on the cancer side. What about just day-to-day general health, prevention, and wellness? Where would you start?
15 milligrams per day seems to be about a really good maintenance dose. I recommend twice a day, so 15 milligrams twice a day. Because one of the other benefits we didn't get to was sleep. People have generally improved sleep quality with it, and it's very subtle. So. And with regard to performance, you have greater tolerance of anaerobic activity, and you're going to have faster repair of any type of injuries. It's anti-inflammatory in a superb way. So if you're going to strain or pull a muscle or cause some soreness, cannabidiol is going to control that. So you've got very fast recovery after vigorous exercise. And your reflexes are about cut in half in terms of the speed with which you can react. Imagine a ball player of any sort being in any type of competition. Improved reflexes will give them the edge in whatever sport that they're in.
Well, that's a wonderful segue to some of the questions we got from our users. And you touched on one that's incredibly intriguing. We have a lot of users now who are using very, very accurate devices that measure sleep quality, and not just total quantity. They report on the amount of time spent in each of the sleep stages: deep, REM, light, total, etc. And there's a lot of Heads Up Health users that are looking to, they're seeing perhaps very low deep sleep or low REM sleep or poor sleep quality in general. And so one of the questions was specifically related to the sleep stages. If you have information there.
Oh yeah, I've got specific information. Cannabidiol has been shown to be effective at reducing the amount of REM type of anxiety-related sleep, and it reduces that particular area, and it leads to greater stage 4 sleep.
Deep sleep. Stage 4 being deep.
Deep sleep, yes.
Yep. So a reduction in anxiety REM, higher deep sleep. That's what a lot of the people who are using the Oura Ring, I have it here, and other sleep tracking devices, the average person now is able to start quantifying these benefits. And I spoke with one of the doctors on our advisory board who has reproduced these results himself. So yeah, very fascinating how this applies to people with good sleep who want to get better sleep. And then what about people who have insomnia? I had one of the questions. So that first question was from one of our individuals, Chuck, who is, he's with a company called Oura. Yeah, so just a little more on how it improves the sleep stages, and then maybe we can segue to insomnia as the next part of the discussion.
Well, cannabidiol doesn't put you to sleep. It's actually been used as a waking molecule. It helps you wake up, be alert, be able to get things done. That's great. But at the same time, in giving that calmness and that relaxation, that really facilitates sleep and a better quality of sleep and a deeper sleep in that process. Yeah, so when people use cannabidiol, it's that side benefit. Using it during the day, they improve their sleep. Mm-hmm. And universally, people will tell me, well, gee, yeah, I did sleep better. I slept better than I usually sleep. Now, it's not anything dramatic, and it doesn't knock you out. It just gives you a normal, deeper sleep, higher quality. But don't take it right before bedtime, because it can activate you. It activates the brain, and you can get really kind of cranked up thinking about things, and that will prevent you from going to sleep.
So how far before sleep would you recommend?
1 to 2 hours before sleep, before sleep time. Yep. It's a lot of variable, because some people do take it in the night. If they wake up, they'll use the CBD, and they'll be able to go to sleep right afterwards. You got to experiment. It's very customized to the individual in use. And that's the same thing for the doses. If you're going to use cannabidiol, you want to find out if it's working, and you want to find the dose that's effective for you. And sometimes whatever's written on the bottle, it may not be the one that works for you, because everybody's cannabinoid system is different. So
of course,
you've got to find the dose that is effective for the symptom
and
that
the dose
you're
and
working
the product. I would
on. And
imagine
you've
as
got
well.
to you should do that quickly. Don't wait around for weeks. I talked to a woman this morning who had been on a product for 3 months and hadn't seen any benefit from it. But for 3 months. And whereas I talked to her, and I like to talk people through their first dose, because when she didn't respond to the first dose, I said, double it right now, double it, and hold it in your mouth and use it for, and hold it for 3 minutes. And then let's see the effects. And then I could see the changes. She changed her voice, the speed of her language, her enthusiasm, and she started laughing at me. And it was an appropriate laughter. It was a humor. It's a lightening of the mood, an improvement and relaxation, so that people will laugh. And it's that normal improved sociability that occurs, a bit of a humor and a smile. Another gentleman I saw today was PTSD.
Yep.
And he was the first time using, I had him take a few of the liposomes. And Elixinol has a product called liposomes, which is a small micro-sized CBD that is wrapped with a phosphate shell that makes it water soluble.
Yep.
So
Familiar with
water.
Yep.
And it has greater potency, greater bioavailability. And so that 1 milligram of the liposomes is about 5 milligrams of the tincture. In his case, he took 2 pumps of it, basically 2 milligrams, and he started smiling appropriately. His voice deepened. Typically, there's an octave drop in the voice. He started talking faster. And this is a Marine that was on a SEAL team that had a trauma, and he had a great deal of anxiety and difficulty. And he took his usual position in the corner of the room, facing outward, so that he was well aware and that hypervigilance was active. With 1 dose of CBD, he mellowed, he relaxed, his voice changed, and he was talking deeper, and he was smiling. And so there was real laughter that came from it. And that's one of the hallmarks of an adequate dose of CBD, is a natural
relaxation. Yeah, you've touched on a few best practices so far. One is to make sure it's 1 to 2 hours before bed. The second is finding an appropriate dose, perhaps starting at 5 or 10 or 15 milligrams. And if you're not seeing an effect, quickly moving up in dosage. You also mentioned holding it under the tongue for a certain period of time. So those are some of any other recommendations on first introducing this and making sure you're doing it properly, first and foremost. So those are a few best practices. Any others that you run into that people?
Well, a lot of people will be inclined to get capsules. And if you get a capsule, that's fine, except that when you take a capsule, it goes into the stomach and it goes through a liver metabolism before it gets into the bloodstream, which may not be as effective for you. But everybody's different. A capsule may be perfectly fine, and it's not the only practical way for you to take it. But if you're not sure you're getting the full effect, bite the capsule and swish it in your mouth, because CBD has an extraordinary ability to be absorbed by the mucous membrane and the skin as well. So you can use it on the skin. Dave, if you've gone to my YouTube, you've seen Teresa, who was an Alzheimer's patient in Canada. And I used the CBD on her, and I reversed her Alzheimer's disease in less than 4 weeks.
Cool.
Topical use only.
Okay.
So it's very, very well penetrated.
Eric is another individual who has some insomnia-related issues. He has to use multiple prescription drugs to sleep on a nightly basis. He had asked how he might start experimenting with this for an insomnia-based use case. What would you recommend in that specific application?
Well, I think I would use about 30 milligrams in the evening, probably supper time or a little bit later, definitely not after 9 p.m.
Okay.
And assuming that he's going to sleep at 11, 10 or 11, something like that. And then see if it's going to benefit him. I haven't had great success with primary sleep disorders. So when people have really difficult sleep problems, CBD hasn't been quite enough. But there's an interesting feature with CBD that taking it, you may not realize that you have slept. So it's really important that you have those devices for monitoring, because that will give you the true indication.
The hard data.
Exactly.
Yep, that's great. Okay, that's helpful. And then Denise had asked, she is dealing with autoimmune condition, ulcerative colitis, and she was wondering if this is something she should consider for her condition.
Absolutely. There's really excellent information about the effects of cannabidiol on ulcerative colitis, and in fact, all of the inflammatory bowel disease and the irritable bowel disease.
Well,
Now, what
especially if
happens?
it's all in the if so much of this system is in the gut, as you mentioned, that it seems logical that if there are going to be benefits, that the digestive related and gut related autoimmune diseases stand to benefit particularly well.
Well, as well as the cramping. There's a great deal of cramping with these disorders,
Yep.
and CBD will stop that cramping.
Yep.
And it will stop the inflammation in the gut.
Yep.
And you're going to get a correction for a lot of these problems very quickly.
Yep.
So there's a number of particular benefits going to reduce the contractions and the hyper irritability, as well as the pain. Now, a lot of people with irritable bowel as well as inflammatory bowel are extremely sensitive in their gut, so that they have many more receptors than are in regular people.
Yep.
And if you can calm those down, you can reduce a great deal of pain, and you can calm down a lot of that inflammation. And specifically, cannabidiol has been very effective at working on those cytokines that are involved in the inflammatory bowel disease. Things like tumor necrosis factor. In fact, that's one of the major biologic therapies that people receive, is anti-tumor necrosis factor or receptor type of agents. Very expensive, on the order of $4,000 a month in order to get those kinds of treatment. And cannabidiol can do at least as well, and in better, without any side effects or immune deficiency type of problems that can come from those agents.
Cool, thank you. And then a couple more here, Dr. Blair. This is from
just
Gina.
Let me say about the dosage on that. You're
Yes,
really
please.
looking at 60 to 90 milligrams.
To
Use
start.
as much as needed to control the symptoms right away, and then back off to a maintenance dose as you progress.
Start 60 to 90 and then back off from there.
Yeah.
Okay. So Gina was reporting that she'd tried CBD oil in the past with nocturnal seizure disorder. And she said, well, it helped with sleep and possibly some relaxation. Subsequently, there was instances of depression, anxiety, and panic attacks. She tried it again a year later with no depression, but anxiety occurred. So again, we don't know what product was used in this case. There's different qualities. There may also, we're not even sure it was 100% CBD. There may have been mixtures of THC in there, and that may have caused it. But what comes up for you with that comment? Is there anything you recommend?
I've never seen depression or reactive depression occur with cannabidiol, with the Elixinol product.
Yep.
I've never seen that sort of thing happen. And there is no rebound. There is no withdrawal.
Yep.
There is no potentiation in that way. So that's very unusual situation. Now, on the other hand, there are some people extremely sensitive, about 1 in 100, that if they take too much cannabidiol, they'll actually get an anxiety and an agitation. Most people get a relaxation and tremendous relief from anxiety.
Got it.
1 in a rare individual will, if they take too much, get a little bit antsy and not be at their optimum. That's easy enough. Just drop down the dosing.
Great. Okay. Very helpful. So just one last question, Dr. Blair, and you're working with a lot of individuals dealing with PTSD, and are you seeing a lot of work around other remedies related to things like psilocybin or MDMA or other modalities? Are you seeing these on the horizons? I know that's not specifically related to your work, but are you starting to see that come up more in some of the clinical research or around some of the alternative therapies that are coming out?
Well, I'm seeing all range of alternative therapies that are being done, not those in particular. Of course, the strong movement for medical marijuana for types. There's a lot of different therapy approaches that people are using, trying to figure out what to do, and behavioral therapy as well as counseling, and loads and loads of drugs. A lot of these people don't respond with, but with PTSD, it's such a superb response with full spectrum cannabidiol. I've been amazed that people go into remission and they have a resolution of their PTSD.
Yep.
So the problem, they don't have to maintain a high dose, and they can continue at a much lower dose.
So, Dr. Blair, last question here. If someone wants to get started, and I went to your website last night, there's a range of products on there. If we were just looking for one for an individual to get started, there were the liposomal, it looked like there were some tablets, there were different products on there. Break it down to the simplest starting point for the person who wants to introduce this modality and start doing some of their own N=1 experimentation. Where would they go on your website, and where should we start?
I think the best product to start with is probably the liposomes.
Okay.
And that's a hemp extract liposomes. And the reason is because it's palatable, and it's got a great bioavailability, it's water soluble. So you can mix it into other substances, and it's very receptive by other members of the family. It can also be used topically. And now, once again, you just have to find the right dose. The price point on it is pretty reasonable at about $59. So that's very, very good. Now, if you want to get the lowest price area and still get some benefit and sort of buy your trial, then the tincture 300 is a great way to go, because it may not last you very long, but you'll find out what is the right dose for you. Now, some people do really well with the tinctures, and some people do well with the liposomes. You got to find out which one works best for you. But the liposomes, the jar of the liposomes can last you a full month. So it's a great place to start. And the standard dose of 5 pumps, which is 5 milligrams twice a day, is terrific. Now, if you find out that you need to have so much of the tincture, like 90 milligrams, you're taking care of cancer, then you want the big bottle of the tincture.
So now, 5 pumps is 5 milligrams, just for people who are trying to correlate back to some of the examples you gave of different starting places, depending on the condition.
Say that again?
5 pumps correlates to 5 milligrams.
That's exactly right.
Got it.
So, and on the other side, you're looking for the premier product Elixinol offers is actually what's called an X-Pen. It's a concentrate.
I saw that.
It's very, very effective, and it has a number of other cannabinoids mixed in with it that give it an extra boost and an effectiveness. And I'm not talking about psychoactive. I'm really talking about anti-inflammatory character that goes on.
Well, this has been incredible. I think this information will benefit a huge number of people.
One more.
Yes.
There's one more. There is a product called Respira that can be actually incorporated as a vaporizer. And so using it in an e-cigarette type fashion, you can get delivery of CBD to the brain in a matter of seconds using it as a vaporizer. It only contains vegetable glycerin and CBD. It does not contain any propylene glycol, which has been concerning. There's been some concerns about that. Very effective, a very low cost. So it's a great all-around benefit, and I recommend it as a sort of a complement to a total CBD therapy.
Yes, well, I know that I'm already excited about starting to incorporate this into my routine. I take a number of liposomal products, so I'll probably start with the liposomal product myself. And I think that this information will benefit a number of people. As I mentioned, we've got individuals who are very invested in monitoring and tracking their health. They're always looking for new interventions that they can try on their own. You've provided us with some incredible information. We are extremely grateful for your time, and thank you for being here today.
Well, Dave, thank you for having me. I'm going to talk about my favorite subjects and how to transform people's lives through cannabidiol and these other measures and a ketogenic diet.
That's wonderful. Thank you, Dr. Blair.